This episode has been released ahead of schedule due to the urgent nature of the subject. In the coming days, the New York State Senate may vote on the assisted suicide bill. Call your senator today and urge them to oppose Senate Bill 138. For more information, visit our website, nyscatholic.org. Hello, and welcome to Capital Compass. We are the official podcast of the New York State Catholic Conference. I'm your host, Gillian. Today, in episode 46, I'll be talking with Jessica Rodgers from the Patients' Rights Action Fund about state-sanctioned suicide in the U.S. Joining us is Jessica Rodgers from the Patients' Rights Action Fund, or PRAF, to discuss an incredibly important and complex issue, state-sanctioned suicide. It's also referred to as medical aid in dying, physician-assisted suicide, or death with dignity. For the sake of consistency in this episode, we'll be using the term state-sanctioned suicide as we delve into the topic. Jessica, thank you so much for being on here.
Thank you so much for having me. It's my pleasure.
Can you start by providing our listeners with a bit of background on what PRAF is?
Absolutely. We're a nonprofit organization that works on assisted suicide and state-sanctioned suicide all around the country. So anywhere that it is currently legal, where we can track and monitor the implementation of those laws, and also attempts to expand those bills as we continue to see around the country. And then we work in states where legislation is being introduced and pushed, such as New York, which has been fighting this for over a decade now and just saw passage in the Assembly. We're focused on really bringing together the diverse parties that oppose state-sanctioned suicide. This is such an interesting issue because it really does bring together, right, left, blue, red, liberal, conservative, to work against this really dangerous and discriminatory policy. So we're a non-sectarian organization. We have nothing else that we work on except for this issue.
As we know, this podcast is rooted in the Catholic faith, and that helped to inform many of the Catholic Conference's positions. But clearly, this is not a religious issue per se. As a representative of a secular organization, can you talk about why anyone, regardless of their faith, should oppose this legislation?
Absolutely. We see a lot of opposition from progressive corners and from disability justice organizations that recognize the really unique threat that this type of policy poses to marginalized populations. So people who historically don't have equitable access to healthcare, whether that is by reason of disability or ethnicity, will find themselves more at risk of being pushed towards state-sanctioned suicide when they don't have access to wanted and needed health care. We certainly see that in states where this is currently legal, where insurance companies won't cover wanted treatment, and patients are increasingly saying that the financial implications of treatment is one of the reasons that they're requesting lethal drugs to end their life. So a policy like this that, really puts crosshairs on people that are already fighting for needed services, while there are many who approach this from a faith perspective, and I'm so grateful for our partners and the faith community. Across the board, regardless of what your faith is, we can say, hey, this is bad for our neighbors, this is bad for our families, this is bad for our loved ones.
Now, many argue that state-sanctioned suicide undermines the sanctity of life. How would you explain this position to someone who might be undecided?
Sure. So, there's an interesting dichotomy in some of the partners that we work with, where not everyone is necessarily opposed to suicide, right? So our organization is really focused on the legalization of physician-assisted suicide, of a state policy that says some people, some lives are less worth living than others. Anybody else, if you walk into your doctor's office and you say, I can't do the things that I used to do, I feel like a burden on my friends and family, and my treatment is too expensive, and I just want to end my life. Your doctor should provide you basic standards of care, which is going to be mental health intervention, suicide prevention treatment. There are standards that are provided if somebody is walking and expressing these thoughts to their physician. And in states where physician-assisted suicide is legal, now we have patients that are carved out from that standard of care and are instead being offered state-sanctioned suicide as a perfectly reasonable option if they are experiencing disability or hardship in some way. And that's just a really, really dangerous policy for anyone who is going to naturally find themselves depressed when facing a terminal illness.
Have you encountered any personal or professional stories that have shaped your views on state sanctioned suicide and like kind of illustrate the real life dangers of this legislation?
So many. I would say every week I receive news stories that just really hit me where I live and really reinforce why this work is so important. My own motivation for getting involved was that I was a caregiver for my mother when she had a terminal illness. And we lived in a state where this was legal. One of the doctors in her practice was well known in town as a proponent of state sanctioned suicide. And it shaped our relationship with that doctor and with the practice. I felt as though I needed to protect my mother from her doctor instead of her doctor being a partner with us as we figured out what the best course of treatment was. So I think people experience those sorts of stories every single day where they wonder, does my doctor think that I have a life worth living? And we know, unfortunately, for people with disabilities, often that answer is no. Doctors are, again, very unfortunately, doctors do have a bias against people with disabilities that they don't think they have a good quality of life. So when you introduce a government policy like this, those biases are going to seep in and they are going to impact how those doctors treat those patients.
As some of our listeners may know, state sanctioned suicide is already legal in some other states. So, how has it been implemented in other parts of the U.S.? Like what kind of regulations, if any, do other states have in place?
The basic framework is all the same. There are slight differences. So the basic framework is that a medical professional, in most states it's a doctor, in some states it's also a nurse practitioner or a physician assistant. If a patient is diagnosed with 6 months or less to live with or without treatment, and that's a very key point, so a 6 month diagnosis, then the attending provider, again, depending on the state, will depend on what sort of medical professional is allowed to prescribe lethal drugs. The patient then takes those drugs home and the state washes their hands of them. The patient is supposed to self-administer and supposed to take them on their own, but there's no follow-up to ensure that that's the case. What we do see around the US is that after these laws go into place, there are expansion attempts after. Some are successful, some are not. 6 states of the 9 that have formal assisted suicide laws on the books have expanded already. And that includes getting rid of a residency requirement. So you have people coming in, meeting with doctors that don't know them from Adam, and prescribing them these drugs that, again, there's no follow through to make sure that these patients are taking them on their own.
As you mentioned that it's self-administering drugs, it kind of leads me into my next question of why does PRAF, along with other, many other organizations, believe that there aren't sufficient safeguards in states where state-sanctioned suicide is legal? If state-sanctioned suicide were to pass in New York, do you think we could see similar issues?
I know we would see similar issues. The issues with the safeguards is that they're really just smoke screens. One of the quote unquote safeguards that proponents will talk about is, oh, 2 doctors sign off on this, right? Well, first of all, that's not that hard. What we see in Oregon is that it is a minority of physicians that write the majority of the prescriptions. So last year, for example, one single doctor wrote over 80 prescriptions for lethal drugs. The median length of time of that doctor-patient relationship is only 5 weeks. If you look at proponent websites like the Death with Dignity Center, they recommend on their website that if your physician, the person who knows you and who might be able to identify if there's depression or coercion or abuse or other mitigating factors in your life, if that physician declines to write a prescription, you can go to any doctor. And they specifically recommend you could go to a psychiatrist or a dermatologist, because if it's a licensed medical provider, then that counts. So this idea that somebody with a terminal condition could just go to a dermatologist to get drugs to end their own life, that is certainly not the safeguard that proponents are touting. Another safeguard is that, again, quote unquote, that they have to self-administer. But as I said, there's no follow through. Nobody has to be with the patient. Sometimes the patients are holding on to these drugs for months or even years. So there's no follow-up to make sure that they retain capacity. There's no follow-through to ensure that they're not experiencing coercion or abuse. The doctor truly does just write that prescription and then wash their hands. So to say that we can have certainty that these patients are self-administering is a fallacy. You can look at the Oregon report, and for so many patients, it is simply unknown if they had complications, if there was anyone with them. For many patients last year, it's unknown if they've even died, and if they did, what the manner was of their death. So the state really only gets the information if someone is with the patient and that someone reports it and that someone reports it accurately, because the patient, who is the vulnerable party here, is no longer there to say that they were a victim.
If state-sanctioned suicide were legalized, what kind of message do you think that would send to vulnerable populations, such as, the disabled and elderly? I know you touched on it a little bit, but I really want to hit home with that.
I think it sends the message that society agrees with them that they're better off dead. And that's really at the heart of suicidal ideation, is this idea that everyone else would be better off if I wasn't here. What we see in the states that do report this data, Oregon and Washington, is that when people request these drugs, it is predominantly not for reasons of pain. Less than 30% of patients ever in Oregon have mentioned pain as a reason for their request. What they do mention is not wanting to be a burden on their friends and family. You have someone thinking, everyone else around me would be better off if I wasn't here, right? I am the person causing my family to stress about treatment. I'm causing them worry. It's a hardship for them to see me fight an illness, and it would be better for them if I was just gone. That's a very lonely feeling. And what we see where this is legal, and what would happen here in New York, is that patients would go to their doctor and they would express these lonely, vulnerable feelings, and their doctors would write them a prescription and send them away, and not give them the standard of care, which is suicide intervention and appropriate mental health care, or appropriate palliative or hospice care that they may need.
In states with it legalized, do we see it disproportionately affect marginalized communities, who already face healthcare inequalities?
Most of the states do very little reporting when it comes to who is accessing this. So it does become challenging to have a lot of specifics. And that's another reason, when proponents say, oh, there's never ever been any abuses at all whatsoever. It's like, well, you're not reporting any data. you're actively providing anonymity for both the patients and for the physicians. We do have examples out of Oregon and out of California of people being denied the treatment, the insurance coverage for the treatment that their doctor prescribed for them. And instead, what you do have covered is assisted suicide. One of our wonderful advocates, Stephanie Packer in California, she had a treatment that insurance originally said, yes, we will cover this. And then a couple weeks after that, the End of Life Options Act in California went into effect. And suddenly her insurance company didn't want to cover her expensive treatment anymore. And she said, well, I know that this end of life options. I know this just went into effect. Would you cover these drugs for me? And not only would they cover it, but it was only $1.20 copay. And that's what her life is worth to the insurance company. So, how many people are already fighting for the treatment that they need and that they want? And now you're going to introduce a much cheaper option that patients facing down mounting medical bills that they're worried about leaving to their loved ones will certainly be a contributing factor if state-sanctioned suicide is legal, is law of the land.
I think this really gets into a good segue about how, the concerns with the healthcare system of, could this be a quick fix? And obviously, as you just talked about, we could see this as a potential to be normalized or even incentivize insurance and healthcare policy.
Absolutely. I don't think that patients who are fighting right now, when we see our disability advocates at the Capitol fighting for the funding that they need for assistance in their daily living, I don't think that they're surprised to see a push for something like assisted suicide, because it really does feed into this notion of how can we provide the cheapest care and still get away with calling it care. And to your earlier point, I think that really informs why you see so much opposition from such different political corners, because everyone loves someone who would be hurt by this policy.
What can be done, both legislatively and socially, to push back against state-sanctioned suicide legalization efforts?
That is my favorite question. So right now we're in crunch time. We've got a couple 3 weeks left of the session. As you know, it already passed the Assembly in April, and we have to stop it in the Senate. We absolutely have to stop it in the Senate. So anybody who is listening, if they haven't called their senator yet, do it now. Please do it now. Call your senator. Tell them that you are a constituent. Tell them that you oppose Senate Bill 138, that you want your senator to oppose it too. I don't care if your senator is a co-sponsor on the bill. Call them anyway. I don't care if they're firmly opposed. Call them anyway, because they are going to be getting a lot of calls from supporters that are putting the pressure on, and hearing from our side helps to give them cover and helps them to know that they are doing what their constituents want, that they are doing the right thing. So if you know that they're firmly opposed, call them, tell them thank you. There are going to be some days over the next few weeks that advocates will be at the Capitol in Albany, holding signs, wearing t-shirts, just being a presence to remind the Senate that we don't want state-sanctioned suicide. If listeners are able to attend and participate, please do. That would be fantastic. And then socially, hopefully, we will have the opportunity to continue fighting this bill. We know proponents will be back next year if we stop it in the Senate, and we'll have to be back next year too. So I would encourage people to look around their community, look at what organizations you're in, and invite a speaker to come and talk about this issue and educate your neighbors, educate your community, educate your local neighborhood association, because this is something that will impact everyone. And a lot of people really don't understand what it is or how it works or why it's so dangerous. Proponents often will present it as this is just an option to help people not suffer. And who doesn't want that, right? None of us certainly want to suffer. But the issue is so much more complicated than that. And it really has so many negative effects that people sometimes need assistance understanding. It is a complex issue. And if you have listeners who can invite someone to just come and talk to a community group, we can really start pushing back on this in a social way.
Thank you so much for coming on.
Thank you for having me.
Thanks for listening to the Capital Compass podcast, and thank you so much to Jessica for coming on the show. We hope you enjoyed this episode. We'll be coming out with a new episode the last Wednesday of each month. If you'd like to support the podcast, please share it with others, post about it on social media, or leave a rating and a review. Don't forget to subscribe wherever you get your podcasts, and to catch the latest from the conference, you can follow us on Instagram and X, formerly known as Twitter, at NYS Catholic Conf, and on Facebook at NYS Catholic Conference. Thanks again, and God bless.